Hello, class. Welcome back. We're going to be going over Chapter 7 today, the skeletal system. We will list and discuss the generalized functions of the skeletal system, identify the types of bones, the major anatomical structures found in a typical long bone, and the structure of flat bones. We will discuss the microscopic structure of bone and cartilage, including the identification of specific cell types and structural features. We'll explain how bones are formed, how they grow, and how they are remodeled. We will also identify the two major divisions of this skeleton and list the bones found in each division. We will compare and contrast the differences between a typical adult male and female skeletons. We will discuss influences of age and environmental factors on the skeleton, and list and compare the major types of joints in the body and give an example of each. So, the primary organs of the skeletal system are bones. Bones are the primary organs of the skeletal system. And the skeletal system does a lot. At first, if you look to the right of the yellow arrow, it supports and gives shape to the body. This provides the internal framework for our body. Next, it protects internal organs, such as the skull protects the brain, the ribs and breastbone protects the heart and lungs. Then it helps make movements possible when bones at movable joints are pulled by muscles. Next, the skeletal system helps to store calcium and some fat. So calcium and some fat. And this is hormones regulate calcium storage. Calcitonin increases storage of calcium, thereby reducing blood calcium level. And the parathyroid hormone reduces stores of calcium, thereby increasing the blood calcium level. And those are very important points when it talks about storage of calcium. And last, we have hemopoiesis. This is blood cell formation that happens in the red bone marrow. Hemato means blood, and poiesis means making of blood. So it helps with blood cell formation in the red bone marrow. Now, there are four major bone types according to their overall shape of the bone. We have long bones, for example, the humerus in the arm. We have short bones. An example of this is the carpals, which make up the wrist. We have flat bones. For example, this would be like the frontal bone of the skull. Irregular bones. An example of irregular bones are the vertebrae in the spinal cord. And some scientists also recognize a sesamoid or round bone category, and an example of this would be the patella or the kneecap. Now, I want to go more into the structure of long bones. Long bones are extremely important. This is where we're going to have the red bone marrow at the end of long bones. There's a lot of stuff that is going on, and I want to discuss the structure of these long bones. You have the diaphysis, which is the shaft. This is the hollow tube of hard, compact bone. And you'll note this on figure 7-1 in your book. So the diaphysis or the shaft is the long tube of hard, compact bone that's in the middle. Now, inside this, we have the medullary cavity. This is a hollow area inside the diaphysis bone that contains yellow bone marrow. Epiphysis, or the ends of the bone, have a spongy bone that contains our red bone marrow. And the articular cartilage, this covers the epiphysis and functions as a cushion. The periosteum is the strong membrane covering bone everywhere except at joint surfaces. and the endosteum is the membrane lining medullary cavity. So if we were going from superficial, so closer to the skin to deep, right? So superficial from deep, we would have the periosteum, then the endosteum, then the medullary cavity. And you can see that here. You see the ends, which is the epiphysis, and that's where we're going to have a lot of the red bone marrows. It's spongy bone, red bone marrow activity to create blood cells. Then in the diaphysis, you see where that compact bone is of the diaphysis, followed by the medullary cavity on the inside. Then again, if you're going in order from superficial to deep, you'll see on the right-hand side the periosteum, followed by the endosteum, followed by the medullary cavity. Now, the structure of flat bones, these are spongy bone layers that are sandwiched between two compact bones. Diplo is the spongy bone layer of a flat bone, and an example of a flat bone would be the sternum or the breastbone. We also have some in our skull. So you can see here where the two layers of compact bone, and then you'll see the cancellous bone or the diplo in the middle where it's more spongy looking of the flat bones. Now let's get into more of the microscopic structures of bones. So bone tissue structure, we have cancellous, which is spongy, and the texture results from needle-like threads of bone called trabeculae that are surrounded by a network of open spaces. Found in the epiphysis of bone, so the ends, and the spaces contain red bone marrow. Then we also have compact bone tissue or compact bone. These are structural units that are called osteons or an osteon. This is a calcified matrix arranged in multiple layers or rings called concentric lamella. Bone cells are called osteocytes and are found inside spaces called lacunae in the Haversian system, which are connected by tiny tubules called caniculi. So here you can see more of the microscopic structures. And here's that Haversian system, the osteon that I was talking about. It's also known as Haversian system. And you can see where it contains osteocytes. Now let's talk about cartilage. Cartilage tissue structure. This resembles and differs from bone a little bit. It consists mostly of an intracellular substance than actual cells. Cartilage cell type is called a chondrocyte. So cartilage chondrocyte. It is located in the lacunae, and the lacunae are suspended in the cartilage matrix like air bubbles. Matrix is kind of this gel-like substance, and it lacks blood vessels. So cartilage does not actually have blood vessels. So you can see here that matrix. It's just this gelatinous stuff in there. Now let's go more into our bone development. So early bone development before birth consists of cartilage and fibrous structures, and it is an ongoing process. Osteoblasts form new bone, and osteoclasts reabsorb bone. Make sure you know that. Osteoblasts form new bone, and osteoclasts reabsorb bone. Osteocytes are inactive osteoblasts. Osteocytes release acids that dissolve the calcium crystals. and cartilage models are gradually replaced by calcified bone matrix. This process is called endochondral ossification. In infants and children, there is an area of cartilage called the epiphyseal plate or the growth plate. This plate remains between the epiphysis and the diaphysis as long as growth continues. Once growth stops, it will form the epiphyseal line in the bone, and that's how doctors on x-rays know if a child has stopped growing or not, on if that epiphyseal line is in the bone or if there is still this more of a space. Now, the axial skeleton, this includes 80 bones of the 206 bones of the body. The axial skeleton consists of the skull, which is made up of cranial bones, ear bones, face bones, the spine or the vertebrae, and the thorax, which are the ribs and sternum, and also the hyoid bone. You can see the image on figure 7-9 in your book, where the axial skeleton is in light blue. Now let's talk about the appendicular skeleton. This is going to be the skeleton that is the extremities, right? This includes 126 bones of the 206 bones in the body. The upper extremities include the shoulder or pectoral girdle, and the lower extremities include the hip and pelvic girdle. And you can see here, so I have some highlights on this that you'll notice, just to make sure you know which part of the skeleton these are located in. For instance, the sternum, ribs, maxilla, mandible, zygomatic, nasal bone, frontal bone, parietal bone, occipital bone, those sacrum, coccyx, vertebrae, like all of that makes up our axial skeleton. The appendicular skeleton is going to be made up more of the extremity bones, such as the radius and ulna in the forearm, the femur, the long leg bone at the top of your leg, patella, tibia, fibula of the lower leg. So again, I'm not going to have you labeling, but you need to know what is in which part of the skeleton. Therefore, you do have to know where these bones are. So again, I want to look at the skull a little bit more. The skull has a lot of different bones, okay, that are pulled together by what we call a coronal suture. Remember, coronal means crown, think of skull. And they're kind of like fused together after we age. That's why babies have a soft spot still. They have fontanelles. And then as we age, everything kind of gets in there and sutures or kind of glues together. And of this, I want you to pay attention because moving forward, this is going to be important for you to know when we get more in depth. So you can see in this image, the green area is that frontal bone. I think of forehead. Okay. You got your nasal bone, which is right there at the bridge, right down there of your nose. Then you can see where the yellow, that cheekbone is called the zygomatic bone. The pink, the light pink on top of your teeth that kind of go up towards that zygomatic or cheekbone is the maxilla. The blue at the bottom is your mandible or your jawbone. Then if you see on the side where your ears would be, that darker pink, that's your temporal bone. If you go from your ears, if you go directly kind of up at a little angle, that is your parietal bone. And then the very back at the base of your skull is your occipital bone. Now let's move on and talk about our paranasal sinuses. Sinuses are spaces or cavities inside some of the cranial bones. The four pairs of sinuses are the frontal, maxilla, sphenoid, and ethmoid. We refer to them as the paranasal sinuses, and that is very important to know. So the paranasal sinuses, going from the top to the bottom here, is the frontal. You'll see the ethmoid here. You can see the sphenoid, and then moving down, you'll see the maxillary. And this is what gets irritated and inflamed in sinusitis, or a sinus infection. This is an image of the hyoid bone. It's not directly connected to any other bones. It is in the neck above the larynx or the voice box. This shows the vertebral column. So I want you to see what I have highlighted here. So at the top of the spine, at the very base of that occipital bone of the skull, you have the atlas, which goes side to side here, and underneath is the axis. And that is why we can turn our head from side to side, is because of that atlas and axis. Those make up what's called the cervical vertebrae, and these are the 7 vertebrae that are in our necks. From there, you have 12 thoracic vertebrae, shown in orange, followed by 5 lumbar vertebrae. And if I was going down this lumbar, look at the top red one, that would be L1, L2, L3, L4, L5. It's the same thing with the cervical, C1, C2, C3, so on and so forth. And then thoracic, T1, T2. So that's how they are described in imaging. Now, at the bottom of the lumbar vertebrae, you can see where L5, you'll see a disc space, which is that light blue, that's the disc, and that goes into what we call S1. The sacrum is just known as S1, or sacrum. And then fused on the sacrum is that little bitty tailbone called the coccyx. On the left side, you'll see the normal curvature of our spines. We have a little cervical curvature, a little thoracic, little lumbar, a little sacral. It's not straight up and down. This just gives you an idea of what a vertebrae looks like. You can see where there's a foramen, that's a hole, spinous, got a little pointy process, got the body, spinous process. So I don't expect you to be able to label this, but I wanted to show you an image of what the lumbar vertebrae look like. This figure shows the atlas and the axis. The tooth-like dens of the axis, which is the second cervical vertebrae, extend along the inside of the anterior arch of the atlas, which is the first cervical vertebrae. So the atlas is C1, the axis is actually C2, and they pivot. So that is, again, why we can turn our head. And this is adapted from a Gray's Anatomy image. So I just kind of wanted to show you up close what that looks like. Again, I don't expect you to be labeling this. Now I want to talk about bones of the thorax. So this is important to know, true ribs versus false ribs. So let's look at this. On the image, I want you to notice the sternum or the breastbone. This is made up of the manubrium, the body, and the xiphoid process, which is that little teeny tiny angle. And when you take CPR, you don't want to break that. So you have to be above that for compressions. Then notice the top, there's your clavicles. And then you see all these ribs. So ribs are talked about in pairs. So when we say pairs, even though I say 1 through 7, there's pairs of ribs, right? So I'm not just talking about 7 ribs. We're actually talking about 14 ribs. So rib pairs 1 through 7 are attached to the sternum by costal cartilage, and this makes them true ribs. Therefore, we have 14 true ribs. Rib pairs 8, 9, and 10 are attached to the cartilage of the 7th pair. So we call these false ribs, and there's actually in total, and table 7-4 in your book shows this, there's 10 false ribs. Then you'll notice, and that's because 11 and 12 are part of the false ribs, they're floating. They are not attached to any cartilage. Now, I want to point out, I have 3 things highlighted on here. Let's look at our, on the left side, the humerus. This is your upper arm bone. And then you'll notice we have on our lower arm, we have the radius, which is on the thumb side, and the ulna, which is on the pinky side. So that's another image of it. Then we have bones of the right hand and wrist. So in this image, you can see again on the left, the radius is the thumb side, the ulna is the pinky side. And I want you to notice that we have what's called metacarpal bones in our hands that runs down in your hands. And then the fingers, we actually call those phalanxes or phalanx. We have a proximal because it's closer towards the heart, middle, and then distal because it's farther away. Next, I want to point out some of the skeleton of the leg. So in image A, this is your femur. This is your top bone up here. These breaks can bleed and bleed and bleed. There's a lot of blood supply in there. And again, this is a long bone, so there's a lot of red bone marrow in the ends there. So in the femur, if we're going up, you're going to notice there's this little notch on the inside called the lesser trochanter, the greater trochanters on the outside. We have that intertrochanteric line. Then it goes into the neck, which goes into the head. This is the part when we talk about hip fractures, you have to know all of those terms and where those are. So the head of the femur is the hip part that goes into the pelvic area, and that little area in there is called the acetabulum, which is not actually shown in this picture. Now, if you go down the femur towards the A, you'll see the patellar surface, and it's kind of more of a cartilage-looking surface, and that is where our knee begins. So let's go to image B. You see the femur at the top, you see the knee bone, which is the patella, and then you see the fib at the bottom, which is on the pinky side of the leg, and the tibia, which is going down on the big toe or the great toe side. Now going down, you see C, you see the fibula, which is smaller. Fib, always think of small I, it's smaller. And then tibia is bigger. Again, you won't be labeling images, but you have to know where they're at because you might have questions with words that describes where a bone is at. Not to mention, you have to know these for anatomical reasons in the nursing program. Now, bones of the foot. This is just showing the right foot. And I just want to point out, remember in the hands, we had carpals with a C. In the feet and the ankles, we have tarsals with a T. Then going down, we have metatarsals that go at the top of the foot. And then when we get to our toes, those are phalanges. And you still have the proximal, middle, and distal phalanx. Now this image shows the arches of the feet. So a normal arch has a normal foot has a little arch to it. But over time, as the foot ligaments and tendons weaken, oftentimes the arches will flatten out, and the fallen arches are known as flat foot, and it can cause a lot of pain. and just discomfort, not to mention as it flattens out, our shoe size kind of changes. So when we're young and we have strong ligaments, leg muscles, tendons that are normally holding the foot bones together, we have a normal longitudinal arch. But again, as we age and certain disease conditions and whatnot, we can end up with flat feet. Again, on the right side, you see the tarsal bones that kind of make up the ankle there. And again, I don't expect you to know every specific ankle bone. Now let's talk about variations in our skeleton. So the size. The male skeleton is generally larger than the female's, and the shape of the pelvis is different. In males, the pelvis is deep and narrow. In a female, the pelvis is broad and shallow. That's why we can give birth to children. The size of the pelvic inlet in females is generally wider, normally large enough for a baby's head to pass through it. So the bones are about that wide there. The pubic angle, that's the angle between the pubic bones of the female, are generally wider as well. And this image shows you at the male at the top, you see how narrow it is, very small circle. As you see the female, the pelvic outlet and inlets both much larger. The pubic angle is larger. So that's how we can identify a male versus a female pelvis if we're just looking at bone structure. Other skeletal variations is age. So the human skeleton reaches its mature state around age 25. After age 50, however, the density or the compactness of the bone will start to decrease slowly. We also have environmental factors, such as if you don't have enough calcium or vitamin D, the skeleton may show signs of degeneration. And we call this osteoporosis. We'll talk about it more in the future. And one thing I want you to really understand is that exercise has a profound effect on the skeleton. An active older person can reverse much, if not all, of the bone loss associated with aging just by being active and exercising. It is very true with the human body. If you do not use it, you will lose it. And this includes bone density. Now let's go into our joints. So our joints are called articulations. Joints hold our bones together and make it possible for movement to occur. Every bone except the hyoid bone, because it doesn't attach to another bone, it anchors the tongue, connects to at least one other bone. There are three kinds of joints. We have synarthrosis. This produces no movement. Amphiarthrosis, which produces slight movement. And then diarthrosis, which is free movement. So this image shows some examples. So synarthrosis, you'll notice here, no movement. That's that coronal suture that happens into the skull that I talked about earlier. Then you have amphiarthrosis, and you can see this in the symphysis pubis. There's a tiny little bit of movement. Also, that's not pictured up here is what's called the SI joints that's on the top of each side of this pelvis. It's called the sacroiliac joints, and they're amphiarthrosis, like arthrotic. They barely move, just a little bit. So again, synarthrosis produces no movement. This is a fibrous connective tissue that grows between articulating bones and, for example, sutures of the skull. Amphiarthrosis, it produces slight movement. Cartilage connects articulating bones, and for example, this would be the symphysis pubis, or what I talked about earlier, the SI, sacroiliac joints. Then we have diarthroses, and this is what most joints belong to. This is your knee, your hip, your shoulders, elbows. Structures of freely movable joints. Joint capsule and ligaments hold adjoining bones together but permit movement at the joint. The articular cartilage covers the joint ends of bones and absorbs joints. The synovial membrane lines joint capsule and secretes lubricating fluid. The joint cavity is the space between the joint ends of the bones, and the bursa is a fluid-filled pouch that acts like a shock absorber. Inflammation of the bursa is known as bursitis. Remember, itis, inflammation. Now, the functions of freely movable joints or diarthrotic joints, we have ball and socket, we have hinge, we have pivot, saddle, gliding, and condyloid. These allow different kinds of movements determined by the structure of each joint. So this is giving just kind of a visual of the basics of most diarthrotic joints. You can see in here where there's the articular cartilage at the end of the long bones. There's a joint cavity, joint capsule. You see the synovial membrane. So let's talk about the different types. So a hinge joint is shown on this diagram as the elbow. It's a hinge. It, go up and down. You can't really swing it around in a circle like you can your shoulder, okay? B is a pivot joint, and this is like in our cervical spine, the axis and atlas, why we can turn side to side. It's a pivot. C is a saddle joint, and this is carpometacarpal joint of the thumb. So like it's a saddle joint, can kind of move around. Then you have D. This is a condyloid joint, and this is at the back of the brain, just above the pivoting of the spine, right there at where it meets the base of the skull, the occipital bone, and the atlas. That's not as important to know. You do need to know this one, though. This is the ball and socket joint, and these are what's located in our shoulders and in our hips, and that's why we can move them around like we can. And then a gliding joint, this is what happens between our vertebrae. So hinge joints, elbows, knees, ball and socket joints, shoulder, hips, gliding joints between our vertebrae. Now, you have to also know all of these terms. There's actually an image in your book that's table 7-7 that explains these and kind of shows these movements. You must know these forever and ever. The first one is flexion. This reduces the angle, as in bending the elbow. Then you have extension. This increases the angle, extends, such as straightening the elbow. Abduction is to move away from the midline, so abduction away. Adduction is toward the midline. Rotation spins one bone relative to another, like rotating your head. And then circumduction moves the distal end of a bone in a circle. So we can do this with our arms and with our hips, right? Proximal end, it's relatively stable. That concludes chapter 7. So go study, and I wish you the best of luck.